All right, so today I'm going to be performing a newborn assessment on Miss Grace's newborn baby girl. I've already washed my hands before entering the room, and I have a baby with side rails up to make sure that she doesn't fall and to secure her safety. And I've also used 2 patient identifiers with the mother. Just looking at baby, I can see that the baby's crying. She's pink and she's moving about, which is obviously a good finding. We want to make sure that her color isn't blue or cyanotic or just want to be that nice pink color. And I've already taken her weight on the separate scale in pounds and ounces as well as grams, and have also taken the length in centimeters in inches and centimeters, sorry. And I'm also going to take the baby's head circumference measurement, and I would put it around the forehead, and I would also do the chest circumference, which is going to be right at the breastbone, and I'm also going to measure the biggest part of the belly to see what measurement it is in inches and centimeters. And I'm also going to be taking her vitals. So I'm just going to be listening to her heart rate. Sorry about my cat. I'm going to be taking her heart rate and listening to her heart rate. It should be irregular, and right now I'm just listening for a murmur. And I'm sorry, it's actually going to be this side that I'm going to be listening with. And I do hear that murmur, which is a normal finding. And right now I'm just going to visualize her respirations as well, while I put my hand on her tummy so I can see if she's breathing all the way in, breathing all the way out. It should be 30 to 60 breaths per minute, which it is, and it's not labored. Also going to listen to the abdomen, and starting in the left lower quadrant. And I do hear active bowel sounds, which is a normal finding. I'm also going to listen to lung sounds on the front and the back, in which I'll hear a little bit of wetness, which is normal, and I'll of course assure the mother of that as well. And I'm going to pick up baby, listen to the back, and I have good lung sounds as well. And I'm also going to take an auxiliary temperature for the baby, and it is within normal limits, and I can tell that the baby is not in pain because of the cry. One of the huge things that mothers and nurses learn is the difference between cries of the baby, and I can tell that this cry is normal and baby is not in pain. So next I'm just going to be looking at characteristics of the skin, which are color, texture, and turgor. Color looks appropriate for her ethnicity, and her texture, there are some little bumps, which is normal, and I'm going to check the skin turgor on the legs and the arms, and sometimes it is kind of hard to tell because baby skin is super tight, and I just see that baby does have lanugo on the shoulders still, which is of course a normal finding, as well as some vernix underneath the armpits, but obviously want to keep that there. It's very, very good for the baby. And I'm going to assess for any rashes or Mongolian spots. I do see one Mongolian spot on the forehead, which is normal, and I do not see any rashes on the back. And now I'm just going to be taking reflexes. So the Moro reflex, I'm just going to snap, and I can see that baby is startled, and the startledness is symmetrical in nature. I'm also going to be assessing her blinks and her pupillary reflexes, and someone has already come in and has done the red eye test, which was normal. And I can see constriction in the eyes a little bit and a little bit of swelling, but that is also a normal finding. I'm also going to do the rooting reflex, which I'm going to just touch the cheek slightly, and I can tell that the reflex is normal, within normal limits, because baby turns to the side that I have touched. And now I'm going to do the suckling reflex, and I'm just going to put my finger in the mouth, and I have gloves on. Put my finger in the mouth, and I can feel that the baby is suckling. And I'm going to feel the palate, which feels normal. I'm going to have baby grasp my fingers, so the palmar reflex is normal. And also the toes, the plantar reflex is within normal limits as well. And I'm just going to turn the baby's head this way. And with the tonic neck, the baby turns the body the other way, which is normal and a good finding. And I'm just going to place the baby on her tummy. And trunk incubation is when the baby should turn when in prone position, and also starts crawling. And I can also see from the back that her buttocks is symmetrical, which is obviously a great normal finding. I'm just going to turn her around. I'm going to be assessing her head. I'm looking at the shape to see if mom had a vaginal birth. She could have cone head, which she doesn't, which is good. But if she did, it would be a normal finding. And I don't feel any molding or edema, which is good, and there are no blood blisters, but in case she did have one, that would be normal. It would just be a hematoma that would heal on its own. And I'm just looking at baby's face. I can see that it's symmetrical, the eyes, the mouth symmetrical. When she blinks and when she smiles, it's symmetrical on both sides. She doesn't have any marks at all besides that Mongolian spot on the forehead, which of course is normal. There was no use of forceps or vacuum, so there are no spots or rashes that indicate that. I'm going to just assess her breathing. I'm going to close one nair, and I can feel that there is air coming out of the other nostril, and same with the other nostril, which is a normal finding. Next, I'm just going to assess the ears, and I'm looking, and I'm just seeing if her eyes match up with her ears, which it does, and if not, it would be a not a symptom of, but a finding that suggests chromosome abnormality, which she does not have, which is great. I can push in her ears, and I can feel that there's good cartilage on this side, and I see that there is a presence of an ear canal on both sides as well. And baby can also recognize and hear mom's voice and dad's voice. You can tell because her eyes light up, and you can just tell that she has good hearing and she doesn't have trouble hearing. Next, I'm just going to be assessing her mouth, and like I said, it is symmetrical. She did have a nice palate, nice hard palate, and it was completely intact. And I can also see that baby's tongue is freely moving, which is great for breastfeeding, bottle feeding, just feeding in general. Next, I'm going to look at her eyes, and just going to be looking at the sclera and the cornea, which baby's eyes were a little swollen, pulling down the conjunctiva on both, a little swollen but pink, which is a good finding. And I had already said that the ophthalmologist came in and did the red reflex. Pupils are round, reactive to light, and baby's eyes are very, very dark, but they usually, they most all the time lighten up once they get older. Next, I'm just going to be assessing her neck, and I don't see any extra nuchal folds, which would be an abnormal finding, and there isn't. does have presence of vernix a little bit on the neck, which is good. We're going to keep that there. And I can also tell that the neck is freely movable. Next, I'm just going to assess the chest. I had already taken the circumferences of what I needed to, but I can see that the chest is rising and falling. She's breathing really well. It's also unlabored. I don't hear that high-pitched sound that a lot of parents think is really cute, but it's actually, I would think that it would be stridor because it's so high-pitched, which is not a good finding, but it is unlabored and within normal parameters. There is, of course, like I said, when I was listening to the lung sounds, there is a little bit of wetness that can be heard, but that's completely normal as well. And there was a presence of the murmur, and she has a nice flat chest with just an extended belly, which is normal. Next, I'm just going to be looking at the abdomen and the umbilicus. I can see that there's Wharton's jelly on the cord, which is normal, and I can also palpate, feel baby's heartbeat, which is super cool. And also I can see that there's a clamp on it, which is normal. There's no inguinal hernias that I can see as of right now. And I can see for her extremities that they are flexed, they're moving symmetrically, which is great. And when I flip baby on back, I could see that this spine was C-shaped, which is also a normal finding. I'm just going to turn her over one more time and look at the hips, and I can tell that there's no dislocation because the buttocks doesn't fold and it's very symmetrical, which is a great finding. Next, I'm just going to be looking at her genitalia. This is obviously a female, so I'm going to be looking at her labia majora, minora, and her clitoris. Since she is term, her labia is not very prominent, and everything is very small, but her clitoris is a little bit more prominent, which is normal. For preterm babies, it would be the opposite. If she was a boy, I would be looking at the penis, scrotum, testes. I would be palpating the testes, and it would feel like little almonds, and I would just be looking for any creases of the penis or testes or anything that looked abnormal. I could tell that her anus was patent because she is having bowel movements. She had one bowel movement and she is only 24 hours old, which is normal. For 2 days old, she'd be having 2 bowel movements, 3 days old, 3 bowel movements, and so on. And also there was 1 rectal temperature taken, which is also a sign of the anus being patent, but we only did that rectal temperature once. Otherwise, we'll just use the axillary temperature for the rest of the taking up vitals. And I've saw that she is voided already with the bowels, and her urine is clear, a little bit yellow, but there's no cloudiness, there's no infection that I can see in the urine. The poop, the bowels are a little bit liquidy, but that's normal because mother is breastfeeding, and so yeah, that would be normal. If she wasn't breastfeeding, it would be a little thicker. And then next, I'm just going to be assessing for jaundice, which baby doesn't really have, but that is first baby will be pink, and then the extremities will be blue, and then they'll start to turn a yellowish color, and that's because of the increased amount of bilirubin, just in case they had a cephal hematoma, that's when the blood vessel will start to break down, but baby's liver isn't totally functional. Baby's liver isn't totally functional, so the liver is having a hard time excreting that bilirubin, so it's going to be increased, which causes that yellow color. And that concludes my newborn assessment.